Big story now, finding patient zero.
A crucial discovery in the fight against the measles outbreak in Metro Detroit.
As we first reported, that man came from the U.S. and Israel and then contracted the virus in New York. Then last month, he drove to Metro Detroit.
This discovery as the number of measles cases in Metro Detroit has now risen to 43. 3 new cases today, 2 in Oakland County, 1 in the city of Detroit. The number of exposure sites stretches all across the state. You can see them all at WXYZ.com.
7 Action News reporter Jen Shahn spoke with the doctor who helped find patient zero. She's in Southfield now at one of the very first exposure sites.
We know patient zero is a middle-aged man from Israel now living in New York. We also know that he visited the one-stop kosher market, a busy grocery store here in Southfield, well contagious. I spoke to a doctor familiar with his case. He tells me the man wasn't aware that he had the measles. Dr. Steve McGraw with Ascension Providence Hospital says when the man first saw a doctor, he thought he had bronchitis. It wasn't until his second visit that he showed a rash, commonly associated with the measles. That's when the doctor called the health department.
He did everything the public health department had asked him to do. Our problem then was to sort of backtrack where he had been and to try to identify the places that he might have inadvertently exposed people to his disease.
In addition to the one-stop kosher market, the man who raises funds for charities visited several locations in Southfield, including several places of worship.
The tough part was we didn't have his itinerary.
Dr. McGraw also doesn't speak Hebrew. He relied on a local rabbi to not only translate, but to help find possible exposure sites, which are now in the dozens. Tests confirmed patient zero had the same strain of measles that recently broke out in New York City, the D8 strain. It's the same strain every Michigan measles patient has tested positive for.
From the time of your exposure, you have about 72 hours if you're not immune to be vaccinated.
For children, I think it's very important.
Based on this community's response to the outbreak, it's clear childhood vaccinations are a priority, McGraw says.
You know that's true, too, because our people that got exposed and got sick were largely adults.
He stresses, though, vaccinations are important for everyone. That man has since returned to New York after being quarantined here in Michigan. For more information on the measles or where you can go to get a vaccine, just head to our website, WXYZ.com. In Southfield, Jen Shantz, 7 Action News.
And our coverage of the measles outbreak continues, as Jen just said, on our website, WXYZ.com. We have very important information to keep your family safe and a complete list of exposure sites.